Counseling 6303 for Houston Baptist University, Chapter 11, presented by Dr. John Spody. Conceiving Children, Process and Parenthood as an Option. Advantages of remaining childless. When someone is childless, they have more time for themselves and their partner, more spontaneity and less stressful marriages, and more financial resources and devotion to their career. Advantages of having children. Children give and receive love. They enhance love between couples. They build self-esteem and a sense of accomplishment. And there's a greater meaning in life satisfaction overall. Becoming pregnant. Enhancing the possibility of conception. Choosing the right time for intercourse just prior to or at ovulation. Methods of predicting ovulation include mucus, calendar, body temperature, and ovulation predictor tests. In China, India, and South Korea, there are strong preferences for sons. Selected female fetus abortion is common and has led to an imbalance. Infertility. This impacts the sexual relationship. This may have a profoundly negative impact. It may cause parts of the couple to feel isolated or to have uncomfortable feelings. Female infertility, or failure to ovulate regularly. This increases with age and is impacted by many conditions. Male fertility. Too few sperm or abnormal sperm shape or motility. This is a major cause of Rossell diamond. Reproduction alternatives. Various alternatives have been developed to cope with infertility. There's artificial insemination, surrogacy, assisted reproductive technology, in vitro fertilization. There are also assisted reproductive technology concerns, financial and health costs, legal, ethical, and personal dilemmas. Pregnancy detection, there are initial signs, a light period, spotting or no menstrual period, fatigue, tender breast, nausea, vomiting, or appetite changes. Pregnancy detection can be completed through blood, urine, or saliva tests for HCG. Spontaneous and elective abortion. Miscarriage and stillbirth. Miscarriage occurs prior to week 20 of the pregnancy. It occurs in at least 13% of all pregnancies, and most are due to random fetal chromosomal abnormalities. There is an emotional impact that can be significant during miscarriage or stillbirth. The individual or couple may consider getting grief support. Stillbirth occurs after 20 weeks. Spontaneous and elective abortion. Elective abortion is a medical procedure performed to terminate a pregnancy. U.S. statistics. 4 in 10 unplanned pregnancies end in elective abortion. 33% of women will have an abortion by age 45. Women in their 20s are more than half of all abortions. How women decide. There are practical and emotional considerations when women decide to have an abortion. There's shared responsibility. Male partners can express their own regard, but they have no legal rights. Psychological reactions to abortions. Feelings of loss, sadness, guilt, regret, and depression. Pregnancy, risk-taking, and abortion. Rates of abortion. U.S. has one of the highest abortion rates, 21 in every 1,000. pregnancies will end in an abortion. Western Europe has the lowest, 12 in every 1,000. Worldwide, about 1 in 5 pregnancies ends in abortion. Procedures for abortion. Illegal abortions. The abortion controversy. Abortion, a historical overview. Laws have changed over time. Back alley abortions led to momentum for legalization. There were several court cases, and court cases are still occurring, including Roe v. Wade. This legalized pregnancy termination before the fetus reaches the age of viability. The current debate is pro-choice and anti-choice or pro-life positions. Experience of pregnancy. The woman's experience. The experience can have a wide range of positive and negative emotions related to pregnancy. Emotions are affected by physical changes. The man's experience. They may feel ecstatic, ambivalent, fearful, closeness or separation towards female counterpart, and or concern about financial impact. Active involvement and awareness of the partner and their needs may vary. Sexual interaction during pregnancy. Pregnancies with no risk factors. In pregnancies with no risk factors, doctors suggest that you can continue having sexual activity and orgasm as desired until the onset of labor. Sexual interest and responsiveness will likely change. Partners' feelings also affect the sexual relationship. They vary from increased excitement to inhibition. Fetal development. First trimester development. Zygote. United sperm cell and ovum. Blastocyst. Multiple cells that implant. Heartbeat can be heard by 10 weeks after last menstrual period. During the second month, the spinal canal, arms, and legs form. By the third month, internal organs have formed. In figure 11.4, the blastocyst implanted on the uterine wall is shown. The first picture is a diagram, and the second picture is a photo taken by scanning through an electron microscope. The fetus at 9 weeks. Fetal development and the actual size at 9 weeks. The fetus is connected to the placenta by the umbilical cord. The second trimester development begins with 4th month of pregnancy. The sex of fetus can be distinguished. External body parts develop. Skin is covered by fine, down-like hair. Growth in size and feature refinement occurs. Fetal movements felt by the end of the 4th month. By the third trimester end, the fetus has opened its eyes. Third trimester development. Size and strength continue to develop. Down-like hair disappears. Skin becomes smoother. Protective, creamy, waxy substance called vernix, caseosis, covers the fetus. Prenatal care. This includes health assessments before pregnancy, good nutrition, adequate rest, routine health care, moderate exercise, and prenatal education. Risks to fetal development. Fetus is dependent on the placenta. The placenta is a disc-shaped organ attached to the uterine wall and connected to the fetus by the umbilical cord. Nutrients, oxygen, and waste products pass between mother and fetus through the cell walls of the placenta. Pregnancy after 35. Pregnancy and fatherhood after age 35. Pregnancy after age 35. There are greater risks and your fertility declines. Healthy older women have no higher risk of birth defects not related to abnormal chromosomes. The rate of fetal defects resulting from chromosomal abnormality rises. Fatherhood after age 45. There is an increase in rare birth defects. Autism disorder, schizophrenia have been associated with higher prenatal age. Childbirth. Contemporary childbirth is a prepared childbirth. Birth following an education process, such as Lamaze. Stages of childbirth. First stage, effacement or thinning of the cervix. Second stage, full dilation until delivery. Third stage, baby delivery until placenta delivery. Delivery by cesarean section. The child is removed through a surgical procedure, including an incision on the abdomen. 3 stages of childbirth. Figure 11.7 demonstrates the 3 stages of childbirth. A, the first stage labor, B, the second stage of labor, and C, the third stage of labor. After childbirth, postpartum period, for several weeks after childbirth. This includes a range of feelings. The baby blues affect 75% of women. Postpartum depression affects 1 in 7 women. Sleep deprivation heightens stress. Breastfeeding. There are advantages and disadvantages to breastfeeding. Some advantages. Digestible food with antibodies. Helps uterus return to pre-pregnancy size. Emotional and sensual experience. And promotes bonding between the mother and child. Some disadvantages include vaginal dryness due to decreased estrogen, temporary breast tenderness and leaking of milk, harder to share the feeding duties with your spouse. Sexual intercourse after childbirth, intercourse after vaginal childbirth. After lochia flow stops and the vaginal area heals, usually 3 to 4 weeks after birth, sex can continue. Intercourse after cesarean birth can occur after the incision is healed. When the desire returns, and this varies considerably, research has found high levels of sexual difficulties after childbirth. Summary. One of the most important decisions we make in our lifetime is whether to become a parent. The realities of parenthood or child-free living are difficult to predict. Pregnancy is divided into 3 trimesters, each of which is marked by fetal change. Many physical, emotional, and family adjustments must be made following the birth of a child.